Hello, Chronicle Keepers, and welcome back to another episode of Community Care Chronicles. Today's Key Chronicle, we're going to be focusing on discussing language barriers in medicine and the methods that we use to help break those barriers. We'll also discuss other innovative ways that could potentially aid in our quest to equitable care for non-English speaking patients.
All right, welcome back, Chronicle Keepers. As Christine said, today we have Dr. Pham, first name, nurse practitioner, and Heidi Youngbauer, registered nurse, senior education specialist. We're going to be talking about language barriers. We appreciate you guys being here. And what we're going to be doing is asking you a series of questions.
Yeah, so Mayo Clinic has these interpreters that we use for in-clinic visits, as well as any financial concerns and at registration. It's important to inform our patients that if they need an interpreter, it's always available and it's at no cost to them. However, before we get into our discussion about language in this episode, we wanted to allow Dr. Pham and Heidi to introduce themselves.
All right, so Vaughn, if you could introduce yourself and on a more personal level, what made you decide to work in the field you are in presently, and any interesting fact about yourself as well?
Sure. My name is Pham. I'm a family nurse practitioner. I've been working in Rochester for about 4 years, 2 months. And the reason I went into family medicine is because when I used to work in the ICU as an RN, I saw a lot of patients dying, whether from lung cancer or stomach bleed or just all type of things that could have been preventable if the patient had good primary care. So that was why I went into family medicine. Interesting fact about myself is that once I became a family nurse practitioner, I realized I really enjoy informatic work. And so now I'm an epic builder for our department in family medicine. And it's surprising how much things you can do that could change a nurse's life and a clinician's life and make their life easier by altering workflow. So it's been good.
Very interesting. Thank you. Heidi, same question to you.
So my name is Heidi. You've already introduced me. I have been a registered nurse for about 18 years now. Worked directly with patients for several years, moved into nursing education, and then was interested in feeling maybe a little more connected to patients, so transitioned into a patient education role, which I absolutely love. It is more challenging than I ever imagined and does bring me closer to working with equity and some of the things that are important to me. An interesting thing I always mention about myself when I'm asked this question is on a very personal level. I have one daughter and she's a leap day baby, which with February coming, even though last year was leap year, is always my interesting fact because that is rare, I've heard. So, yeah.
Like, that's the first time I've heard of a leap year baby, honestly. Yeah. So thank you for sharing that. It's interesting.
So it is interesting.
Yeah. All right. So we do have a few questions here. We'll kind of get down into a little bit more. Vaughn, what language resources have you used during your patient care here at Mayo Clinic?
So if it's a Vietnamese patient, I typically don't use an interpreter because it's more efficient for me to just do the visit in my language and then document the note in English. But if it's in other languages that I don't know, of course, there are always resources at Mayo Clinic. There are the language service line, the iPad interpreter, and in-person interpreters. I think it's the hardest to get in-person interpreters just because they're rare and they have to know of the time ahead in order to show up on time. iPad interpreters are more accessible, but we're limited on the number of iPad available. So that's the other problem. So most of the time, I think I've been using the phone interpreters or the language line interpreters, but probably my preference is iPad.
I think it's very true because there are some times where I forget, Christine, what languages that we have to schedule an appointment to talk with patients.
I think Dinka is one.
Yeah, Dinka, and more recently, I'm gonna say this incorrectly, but Tagalog. Did I say it correctly? Hopefully, I don't know. The audience, whoever's
Some
listening.
languages I've never even heard of before there. So.
There are some more. So that's very interesting. And you're trilingual, bilingual?
I'm learning Spanish. I got like 2 years of Spanish in college with medical terminology, but of course that's never enough. Oh. So I can say like conversational things with patients in Spanish, but not like trying to diagnose them. That's hard.
What's the less common spoken languages that you've encountered besides Dinka that we just mentioned?
Well, for me, I think it's DARI, DARI.
Oh,
Like when I have a patient with that language on my schedule, my nurses have to work like 2 weeks ahead of time to
wow.
get somebody to show up for the appointment. And this is only just phone interpreter, guys, and we had to get them ahead for 2 weeks. So, yeah.
Yeah, so being the chair of the Diversity and Equity and Inclusion for Family Medicine, what current projects are you working on regarding languages and the barriers that you may have found? And who do you collaborate with to move forward with the project?
Of course, my partner in crime here, Heidi. We've been working very hard over the last few months to get current languages that are in high demand for our department in family medicine. So for our patient population, I think we have about 120,000 patients in family medicine from across Rochester. Of course, most of them are Caucasian, but I think there's 1% Somali, 1% Spanish-speaking patient. Surprisingly, Vietnamese was the next popular one on our radar. So we have Spanish translated material within Epic already. We don't have Somali, which is something that Heidi and I are working on very hard to get that material into Epic so that when the clinician or nurses want to send patient material, you just click into that box, attach it, send, and you're done. Instead of going to a different website, clicking on multiple links, and then having to download it and then reattach is a lot more work. But of course, it is going to take some time for us to get there where it's available. So right now, in the interim, what we're trying to do is just have the material available in clinic. So we're trying to make it easier, but change takes time. So, yeah.
So specifically, you're just doing the language Somali because it's more common here now?
It's the second highest in demand besides Spanish. Now, that's specific for family medicine because that's the patient population that I'm caring for. I don't know for like peds and CIM. I don't know if you know, Heidi.
I would say Somali is the language of highest request for us in patient education. Outside of, as Vaughn said, we have all of our content in Epic in Spanish. So that need is typically met through the content we can access in Epic, but besides Spanish, I would say Somali would be right up there.
Next one.
And, well, I should say Arabic, but then Somali.
Oh.
The Spanish, Arabic, and we've simplified Chinese have kind of always been the highest. Right behind that, I would say, is Somali.
You're in doctorate nurse practitioner school right now, Christine. What common language have you encountered recently?
Well, I've been working a lot in the outer, smaller communities around Rochester, and I see a lot of Hispanic families. So most of my patients are Spanish speaking, and, the small clinics that I had been learning at don't really have the technology that Mayo Clinic has. So unfortunately, we have to use family members and also maybe like a Google Translate to speak to patients.
Google.
But these clinics are, for people who don't have insurance. It's like bare minimum trying to help these people. So we're just doing everything we can in order to make sure that they get the proper care. So we'll take what we can get.
It's interesting. I have some external resources, but we'll go over those a little bit here later.
I do want to say one extra thing.
Okay.
Just a shout out to Heidi and her team is that when I came to her for this project of having more Somali translated patient content into Epic, I also wanted to talk to her about like the different patient population that are printed on our pamphlet and how it wasn't very diverse. But her team was already working on that.
Oh, yeah. Get some diverse pictures, and that'd be kind of cool.
That is a project that they're currently, it is in progress. So I'm glad you brought that up. We have a lot of new, more diverse photos in the media asset management catalog, and then also going through a lot of product redesign where those types of photos are added to our materials, and so that the images, as you said, are more diverse and people can see themselves a little bit more in our education.
I got a sneak peek. It's great.
Yeah. I think it's amazing. Not bragging or anything, but I am in a couple of those pictures, so if you're seeing me, I'm with Dr. Suarez, who's our EID lead. I'm out there, guys. Just, if you want an autograph, let me know. Christine, you're also out there, too. Yeah. Christine and I. So I think it's a great way to show our diversity out to the community so that they can visualize themselves being as a part of their patient care in a way too. So I appreciate that. Do you specifically have translators that are external, or are they internal, that work with your documents or pamphlets to translate?
We have a content linguist. We have our own team that is always at work with our patient education materials. And we're very focused on, as Christine said, sometimes you really just have to use what you can, I think, with patients, but Mayo is really focused on quality and making sure that what's out there is accurate and that it provides an equitable experience to our patients that don't speak English. So some of our processes maybe do seem to take a little bit more time, but that quality piece is very important.
Yeah. I definitely agree with you. Some translations can be very inaccurate and mean something else. Even in the same language as Spanish and Vietnamese, there's different dialects, so one thing can mean a completely different thing. I definitely applaud you and thank you so much for doing that work as well for our community. Do you got any more questions for Heidi?
Well, I was curious about after visit summaries in particular. When I was, working in the hospital as, an RN, I would try to print off these after visit summaries in different languages. And I'm just wondering what initiatives are being put forth to help kind of get more languages put in there.
The after visit summaries come from Epic, so come from the actual EHR. We don't have a lot of control over what languages are available in Epic currently. The content that we did translate is specific to patient education. I do know that there are templates that you're able to change the language that it prints in, but only the specific template and material will come out in the language you choose. So anything in addition isn't necessarily translated. So I think there's a lot of requests in to improve some of those options in Epic. However, I am not much of an Epic expert, so that would probably require we do have an informaticist on our team in education, but we're really focused just on the patient education material.
I wonder if artificial intelligence could help with that, like having a translator, an artificial intelligent translator.
I
feel
can speak
like
to that.
Okay.
So Mayo Clinic is piloting a bridge as an AI ambient documentation. And supposedly, if you speak in Spanish with a patient and the patient responds back in Spanish, it listens to it and your note will be in English.
Does it keep the dialect does it have a Spanish version and English version saved up with it?
I don't know, but most clinicians would read English, so supposedly it puts everything into English. So that's interesting, right?
So maybe the provider could just speak and transcribe their instructions into the AVS that way.
That sounds amazing.
$1 million idea.
I think I would like to have the Spanish and the English just in case, because I know if we were to write, say the instructions in English and it prints out in Spanish, as a person who is bilingual, I speak Spanish and English, I would like to have both just to make sure that it's correctly translated. But I think with the AI, I may be more comfortable with it already translated. So I think you have a point there. I see where this is going. I like the idea. I think I'm a little hesitant, but I love technology and I'm up for innovation, so I just have to be more open to it. So that's happening then, the program.
Not the patient instruction, it'll write it into your note.
Okay.
So if you say patient should take ibuprofen every 6 hours, the dose, it'll write it into the note, but not in your wrap-up section where you print things out.
So when you prescribe, it's prescribed in English and it gets sent to the pharmacy. Can you do that? Can you order prescriptions yet?
No, not yet.
What if you could order prescriptions and give the instructions? And like you said, it goes to the pharmacy already translated. TM.
That would be so fancy.
TM.
That's in the future. Maybe three, four years down the line.
Wow. Okay.
Exciting though.
Heidi, do we have any material for patients that are blind or even audio recordings for those that are hearing impaired when it comes to patient education?
I spoke with colleagues before we met today, just knowing that I know little pieces of of mostly the practice areas that I work with. So I reached out just to kind of understand a little more what's available. And our instructional designers are very focused accessibility, and everything that's created does meet accessibility standards. So when you think of things like screen readers, the way that the content is set up is optimized for screen readers. And I don't know if you've ever had that happen where your screen is being read to you and you don't want it to be. And if it's not optimized for screen reading, it can be very distracting. And so the content that's created within Mayo is all of those things are looked at from the very beginning. So things like screen readers for vision impaired, font, color contrast, all those kinds of things are taken into account, especially for the more digital experiences. And then, of course, we have captioning and things like that for people who would have more of a hearing impairment.
Okay, interesting. Do you have any material that, say there's someone who's visually impaired but also hearing impaired as well, like any Braille or anything like that?
Our content has not been created in Braille. That's not something that we've done so far. I know that there are resources within the state, I think, that can be accessed for people who have those kinds of learning accommodations needed.
Okay.
Right.
Interesting. Another great idea. Yeah, that's really fascinating. So, okay, so recently you talked about you're currently working on a project with Pham. What specifically is your position in that project?
My role is to be in contact with the practice and to understand the needs of family medicine, community internal medicine. Primary care is the specialty that I cover. So just really understanding the needs, understanding how the content or how the request is going to be implemented in the practice really helps. So talking with Pham and understanding, we do have content in Somali that can be printed and ordered, but then also understanding after talking with her that really that doesn't meet the workflow needs in family medicine. You really need to have those order sets and some of those workflows that you have for our English speaking patients so that it flows just the same. So kind of just understanding that, bringing those requests back in a way that makes sense more to leadership so that they can understand as well.
Because truly it is an inequity, right? Because we have this content available in English and it's so easy to just click done, print, and the patient has the material. But here we have patient from underserved background, a minority, and we have, as clinician, go through more steps to get care for them while our day is already so short. We don't have time, and we're making extra effort to walk outside, find the content, or go through click, and then print. It creates more barrier for us to do it. And I'm going to be very honest, on a very short day, I'm not going to do it. I tell the interpreter, hey, the patient needs their mammogram, needs their colonoscopy, needs this and this and this. Are they willing to do it? Can you ask for me? If they accept, then I sign. But of course, most of the minority patients, they don't know what those things are. They're from a third world country like myself, like Vietnam. Most of my patients don't know what a cervical cancer screen is. They don't do colonoscopy. They don't do mammogram. And so it takes time to explain those concepts to them. But now that you're already short on time, it's like you're in this vicious cycle of wanting to provide good care, but you can't. So if we have those material in place, I think it will really help.
So then what, and I think you ran into this, Christine, taking care with your patients. What's some external resources that you've utilized with your patient care recently?
Well, because I talked to Heidi and she's amazing. So I've been going to MedlinePlus for those Somali resources. You can also search them on like the Mayo Clinic website under forms. If you're looking for colon cancer pamphlet, you can actually order them or print them out in specific language, which I didn't know before until I met Heidi. So that's kind of like the workaround regarding that. And I do plan to like print all of the preventative care out, put them in a nice little neat folder. So if my clinician or my colleague care for a patient who speaks Somali for an annual wellness visit, they can just grab the folder, hand it to the patient and say, hey, you need to do all these things. You don't have to make a decision right now, but go home, you can review them. And the next time I see you, please consider doing some of these screening. We recommend them because they're the things that kill most of us in America, these cancers. We know from research that education is probably not the number one thing that will change people's mind. But if we have it for a Caucasian English-speaking patient, at the minimum, we should have it for other patients from minority background.
What resource have you used recently that's external?
Actually, just Google Translate. Like I said, these clinics that I'm at are very, they're privately owned and they're new. And so it's kind of, there's not a lot of resources out there. Mm-hmm. And so a lot of times it's just Google Translate, writing something down like in Spanish on a piece of paper for them. So yeah, it's difficult, but it's really helpful if there's a family member there that also speaks English.
Interesting.
Do you have other resources that you recommend?
We do have a policy about external resources that are approved for use by Mayo, and just kind of with a little bit of a caveat disclaimer that they haven't all been quality checked. Like MedlinePlus is one, and I shared that with you. Those outside resources haven't been quality checked by our patient education linguist team. So we can't guarantee that the quality is the same, but it is something that's been approved by use according to our policy. So we've got MedlinePlus, health information translations. These things are also available on our webpage, which is to let everybody know it's going to be redesigned soon, which will make it a much easier experience for people to find patient education within the intranet. So that'll be helpful. So the MedlinePlus and health information translations have been the major two that we were kind of our go-to. Recently, they approved UpToDate, which I know we use a lot as, clinicians and providers to go to that for care, kind of care pathways and things like that. They also have patient education in many different languages. I think I counted up to 18 or 19. Unfortunately, not from
Somali. I was going to say that.
The ones that we need.
The most common, yeah.
Here, right. But then there's so many others that you both mentioned that haven't come to me as a request yet. Another one I've had more requests for recently from the health systems is Hmong, and that's another one that can be a little hard to find. So those, I think, are the biggest three. We also, within our medication resources that are found in Epic and also on the intranet, we use Micromedics, and some of their care notes are translated as well. So that's helpful, I think. And Micromedics is the kind of the go-to for our medication information. So it's nice to have translations there too.
I think another important one for patient to know is ChemoCare.
ChemoCare.
It's a very good website that translates all of the chemo drugs into different languages with side effect, what to watch for. And that is a hard resource to come by if you just look randomly on the internet. But it's a great resource.
Is that one of the Mayo approved ones?
It is, yeah.
Oh, wow.
Yeah,
okay.
It's just approved as well, just within the last year or so.
I have some external resources that I kind of looked up. There was the Intercultural Mutual Assistance Association. It's a nonprofit that has free language services and other programs as well. Have you utilized there's Mayo Clinic, or have they checked them, or are they approved by Mayo, or is that something that we should utilize?
The position of patient education when we talk to clinicians, providers about using education is just really using your own clinical judgment. We aren't here to tell you what you can and can't use, but we can tell you what's approved according to Mayo policy.
Gotcha. Okay.
And the education that you're more encouraged to go to. So if you find a resource and have from your perspective, feel like it's appropriate for your patient, and especially when you're bilingual and you can maybe assess it yourself, the quality of it's within your scope to use it.
Yeah, that's valid. I will definitely check them out to see how their translation goes. I've had occasions where I've had to call a Spanish translator just because certain words I've never translated that word before. I know Mayo interpreters have very high education when it comes to medical terminology, and finding out that they're saying exactly what they need to say, it kind of soothes me and it makes me feel comfortable that I know that I'm giving my patients the right care and the correct information, as opposed to me just kind of going with the slang that I've learned as a child. But yeah.
Right.
I just want to say that you guys are doing such important work, and it's so huge to have accessibility for these patients, and you're going to move mountains with providing better health equity for our patients in Rochester. So thank you so much for the work you're doing.
Girl, I'm only trying to move 1 millimeter.
You're doing
that's progress.
Yeah.
It's overwhelming when you look at all of it, but
Yes,
right, I agree. You have to celebrate the small wins, I think, and just keep moving forward. And as you were talking about technology, which is not my area of expertise either, but things are changing so quickly. I have a lot of hope that, within the next year, a couple of years, we're really going to see some improvements in what's available for our patients that don't speak English or that have other, different abilities that we need to accommodate.
Yeah, most definitely. So just to kind of recap on the internal resources that we have, you mentioned the MedlinePlus is something.
That's external.
Oh, that's external. No, but it's Mayo approved.
It is Mayo approved.
But the link is on the intraweb, right?
It's
okay,
on our
so
patient
then
education page.
so it's internal for providers to use and registered nurses to use. Is this MedlinePlus also externally? Because we have the link in our intranet, but it's also you can use it externally. Okay, so this is a good resource, Chronicle Keepers, to utilize if you work for Mayo and if you don't work for Mayo, if you're a patient. Another thing that I have noticed, and I was going through the Mayo Clinic kind of website, diagnosis website. Top secret, Vaughn is my wife, actually. Not a secret anymore. She showed me something that I found very fascinating. When you're scrolling down to the bottom of that web page for diagnoses, there's something there. Heidi, I kind of want you to explain something or maybe you know what I'm talking about.
Heidi showed me that.
Okay, Heidi, can you explain to us what is at the bottom of the web page when it involves like language?
MayoClinic.org.
Yes.
When you're looking at our external content for consumers,
yes.
is what you're talking about. Yes, there is MayoClinic.org that has a lot of materials on many, many different health and wellness and disease-focused topics. If you go to the very bottom of the page, the lower right-hand side, you can change the language. You can change it to Spanish, simplified Chinese, or Arabic. And so when you do that, it changes the entire page. So if you didn't look at the version in English, when you change it, it'll completely change. So you'd almost need to pull up the English version to kind of compare what you're looking at. But yeah, that's a nice feature for more of our external
users. Yeah.
Right. Our patient education is typically really tries to focus more on the patient experience and a more specific parts of the care journey, so to speak. So it's not going to be quite as general of informational as what you find on MayoClinic.org, but the MayoClinic.org site is very comprehensive.
That's interesting. I didn't know that, and I've been here for 4.5 years, and I just find that fascinating. Is there any project or thought about including more languages at the bottom there? Is that another project?
Oh, I hope so.
Okay.
I don't know. I think that would be a good question for me too.
All right. Okay.
That would be a good question for Office of Health Equity and Inclusion.
Within it. What I also, as a registered nurse, we have immunization sheets that we give out, which is the vaccine immunization sheets, the VIO sheets. What I found externally, now this is not something that it's approved by Mayo, but for Chronicle Keepers, for your external use, if you want more information on vaccines, it's the immunize.org, and you can find translations of, I think I saw Dinka on there, German, Spanish, you name it. It's a plethora of different languages. Maybe you guys could take a look at it and see if it would be a great resource for Mayo Clinic as well.
I think the CDC website would have that too.
Yeah, I think it's actually tied with the CDC website. So, and as Mayo Clinic, we usually follow CDC guidelines. Mm-hmm. So maybe take a look at that, and just a resource that I have found very useful as well. I think maybe this is a little bit off topic, but the Rochester, Minnesota government website also has some resources, whether it's language barriers or health, education. They have a DEI program as well. And then there's also the Southern Minnesota Regional Legal Services. If you are here living in Rochester and you need legal services, these are pro bono services too as well. You can volunteer if you're a lawyer, by the way, that speaks a different language, to assist some of the citizens here in Rochester or Olmsted County. So that's another resource out there that I think is really fascinating. Besides that, I don't have any more questions. We could go on a personal level, but I think maybe time is catching up to us. Yeah. Mm-hmm. What's the next episode that we're going to be talking about, Christine?
I believe we'll be talking about nurse practitioners and what they do, because it seems like there's some confusion sometimes. So I think that'll be a really great educational episode.
I believe so. Well, thank you guys for being here. We appreciate your time. Had a good time doing this, and look forward to see the project fruition for you guys too as well with the language barriers.
Thank you.
Yeah.
Thanks for having us.
Thank you.